wonderful initiative. It's, whatever we say, there's no more thanks to say, because this is a thankless field. There might not be much of, financial benefit, but then the suffering which millions of such people undergo, and you have brought about this kind of global initiative, first of its kind in our country, and which is going to be produced all around the world. It's a wonderful, it's a thankless job. Yeah.
This subject, which was largely neglected globally, not only in India, has taken lead, and I have no doubt that we are going to surpass any such effort anywhere in the world. And there was a great meetings, a series of meetings in the past 7-8 years, and it is taking now, maturing into a new shape. And this has given us opportunity for multidisciplinary thoughts, where we are just like tumor boards. Multidisciplines are involved for this treatment of this devastating condition, that is painful bladder syndrome. Now, the bladder pain syndrome is not one condition. It is a collectively symptom complex where not only urologist or gynecologist or any other pain specialist is going to have the complete control. We all have to make a body. Lot of research is needed because the literature is lacking. We want to set an example that we are the leaders of giving the insight of this disease and also the solutions.
This is quite a problematic condition for the women who suffer from this, because it affects their quality of life to such an extent that sometimes they even have developed suicidal tendencies. It can be that severe a problem.
Bringing the awareness to the physician, that is a good right move as an industrialist, as an visionary.
I'm really impressed by the fact that so many the leaders, the professionals from all over the country, and some of them even from outside the country, have been here to really take part in these deliberations and to learn from each other. We are all here to share our experiences and learn from each other what we've been doing, what others have been doing about this problem, so that actually we will all help each other and in turn help the patients who need us.
My primary statement would be for all clinicians to be aware of this particular problem as a differential diagnosis. When patients present to you with painful bladder, especially on the filling, when the bladder is filling, they complain of pain, which might or might not get relieved on voiding, especially in a female population, because they can present to multitude of, especially to gynecologists. I want to emphasize on importance of avoidance of unnecessary use of antibiotics, which are not definitely going to help the patient. Avoid unnecessary surgical interventions. At the end of the day, nothing will help unless you have a proper clinical diagnosis at the very outset. So the basic aim is to have a high degree of suspicion and to avoid unnecessary investigations and interventions.
As a female urologist, I see a lot of patients who have the problem of chronic pain and lower urinary tract symptoms related to the bladder. But many of times these patients, they don't know actually where to go. They've been treated for urinary infections by so many doctors, the general practitioners, gynecologists, and sometimes even by urologists. Even though there's no evidence of infection, they go on taking these antibiotics, and finally, when they don't find any relief, they keep on changing the consultants. And now we know that apart from infections, these symptoms can be caused by a syndrome known as bladder pain syndrome, which previously was known as interstitial cystitis.
It is only the tip of the iceberg that we are seeing. There are many patients who have the chronic interstitial cystitis disease, and they have not been diagnosed. That is where the problem is. So we have to look for it, we have to get them and treat them, because they will be benefited, definitely benefited. Instead of sending them to the psychiatrist, I think we should be treating them ourselves.
I'm in a teaching institution. Just 2 days back, before coming for the flight, I had a class from 8 to 9. And I thought, let this be the topic of my class so that I get warmed up for the session. And I taught the MBBS students about this interstitial cystitis and bladder pain syndrome.
I invite like-minded people, my colleagues, both gynecologists and urologists, as well as urogynecologists, to be part of this GIBS so that we can all together go forward from here and help these women who really suffer in silence.